Hey, welcome back. Let me talk about blood to try to help you out through this chapter because it is a very important chapter and some of it's a little bit tedious. You should do fine, just keep studying, but let me try to help you out with some of the finer details. Remember that the blood's importance is because of what it contains. So it contains white blood cells, red blood cells, plasma, it contains hormones, it contains oxygen, it contains carbon dioxide, and it contains other waste products. It also is what makes heat in our body, and that's really important as well. It's nicknamed the river of life because of all of these facts that I told you. Okay? All right. It is considered a connective tissue. It does have living blood cells. It also has formed elements in it. It's all going to be suspended in plasma, which is the non-living fluid. Right? You can definitely see the visible proteins. The one you're going to be most familiar with in this class is fibrin. Okay? Fibrin's important during clotting. Whole blood is made up of some major components. It's made up of plasma, which is going to be about 55% of your blood volume. You're going to have something called a buffy coat. That buffy coat is always not that much as far as comparison to the red and white blood cells. So it's less than 1%, and that's where your leukocytes and platelets. When we say less than 1%, that means that the percentage is really based on, is there something going on in your life right now? Are you sick? Because if you're sick, the numbers of leukocytes is going to increase. Erythrocytes is going to be the last component to whole blood, and that makes up 45%. Blood's characteristics, well, most people can say it's red and it's liquidy, but that's not all that it's cracked up to be. You also be able to have to tell me that it is sticky. Okay, remember I told you the blood splatter test? It shouldn't run down the wall very fast. It should go very slowly down the wall because it is sticky. It is opaque. Healthy blood is something that you generally can't see through easily. Okay, it does have a metallic taste. When you have tasted blood, you have tasted a mineral-like flavor to it. Also, if you're really good with your sense of smell, when blood is being donated or somebody is cut near you, you can smell the iron in their blood. It's 5 times thicker than water, so when it's put into a water beaker, it should fall to the bottom. It should have a pH between 7.35 and 7.45, which is considered neutral, and is relatively about 100 degrees in temperature. It does represent a large component of your body, where it's about 8% of your body weight. Okay. Functions of the blood, there's a few of them. Distribution. Okay. It has to deliver oxygen. It has to pick up metabolic waste, which is carbon dioxide and urea. It has to pick up hormone and transfer it to where it's got to go. That's distribution. Protection is the next one. It's protecting from blood loss. What happens, hopefully, naturally, when you have a cut? You should clot up so you don't lose more blood than necessary. Blood also tries to prevent infection because remember what it contains inside of the blood being transferred around. You have antibodies, and you have proteins, and you have white blood cells to try to protect you from being ill. Lastly, you have regulation. Okay? It regulates or maintains your body temperature. It tries to keep a normal or neutral pH. When necessary, blood will act as a buffer to try to bring it back to normalcy, and then it tries to keep adequate volume within the circulatory system. Remember the fact, based on homeostasis, blood volume does not like to change its amounts. If you're at 5 liters, altering that causes some problems. So it wants to fill it back up or remake or maintain that blood volume to where it's at 5 liters. Okay? Plasma is 90% water. It is definitely the liquid part of blood. It's the most abundant and contains tons of plasma proteins. It has solutes, antibodies, and hormones. So that's the carrying of all that. Most of the plasma proteins that you find are going to be made by your liver, and plasma proteins are not going to be taken up by cells as a way of food fuels. So it's really important to understand that the proteins that are kept in the plasma are for the blood and the needs of the blood. Taking it elsewhere into tissue cells or anything like that jeopardizes the maintenance of the circulatory system. Okay. The one plasma protein that I ask you to memorize is going to be albumin. Okay, it acts as a shuttle. It literally circulates through the blood. So what it does is anytime there is something causing the pH to be off in the blood, the albumin acts in a way to try to buffer it and put it back to normal, and it also acts in a way to grab things and tote them around where they need to go. Okay? Okay? 60% of the blood plasma that we do have is going to be albumin. Okay? What do you consider formed elements? Erythrocytes or red blood cells, leukocytes or white blood cells, and platelets. Which one of these is the true blood cell? Well, you need to understand that white blood cells is the only true blood cell found in the blood. Why? Because it has all the nucleus and organelles that the others do not. Okay? All right. Please also keep in mind that these formed elements come from stem cells, just like anything else in the body. Okay? All right. Let's start with erythrocytes. Erythrocytes are anucleated. That means they're without a nucleus. Their job is to carry oxygen to all cells. They also are made up of iron. They have hemoglobin. Okay? They have no organelles when they're mature. Now, before they mature, they have other organelles within them. Hemoglobin is the iron-bearing protein that contains 2 alpha and 2 beta. There is no mitochondria, so respiration can only be done anaerobically or getting energy through that. You have 1,000 red blood cells for every white blood cell. That's normal. Any alter to this is going to change the viscosity of your blood. Okay, we remember I did some math. For every 1 red blood cell, you have 250 million hemoglobin. Each hemoglobin can bind to 4 oxygen. So if you have 250 million hemoglobin and 4 oxygen, how many oxygen can 1 red blood cell make? Math. So great early in the morning. The answer is going to be 1 billion. That's a lot. If you have a disorder or disease, or you have some sort of trauma where you lose a lot of blood, you do the math. Why? That's why they check your blood oxygen when you go into the OR. It's jeopardized. Okay? Alright. Alright. Let's see. Let me see what else did I want to tell you. Alright, for development and maturity for the red blood cells, starts as a stem cell. It's a hematopoietic red blood stem cell. It's in the red bone marrow. Its first division is going to change it into a proerythroblast. That's telling the body that it is a committed red blood cell. It can't change to anything else. It is going to stay as a red blood cell. Okay? When it goes to cytoblasm, it's going to have tons of ribosomes. Remember, ribosomes produce protein. Protein is utilized for energy. This is giving the cell energy to become what it needs to become, a mature red blood cell. Okay? Shortly thereafter, organelles are going to be ejected. Okay? Except for ER. ER stays until it becomes a reticulocyte. When it's a reticulocyte, then the ER will be spit out, and now it's considered a mature red blood cell. Okay? Alright. Alright. Again, like I've said, amount of red blood cells in circulation must stay constant. because there's a constant flow of hormones, nutrients, and iron that must go around. The lifespan of a red blood cell is 100 to 120 days. It happens because, normally speaking, they're fluffy, they're really soft, they bounce through the blood vessels, but as they age, they actually become more brittle and hard, and they can't do that very well. At that point, they're not going to survive much longer than that. They don't have, red blood cells don't have growth or development because, or division, because, yes, this is question answer time. Right? They can't do it because they don't have any organelles. They have no nucleus. How are they going to divide and grow? So they're one life. When they hit that lifespan of 120 days, the macrophages will then attack them, engulf them, and they'll be broken down. Hemoglobin will turn into globin and iron, and heme will turn into bilirubin. Don't forget the diseases I talked about: anemia, sickle cell, polycythemia. Okay. White blood cells. They're extremely important because they're going to fight against bacteria, viruses, parasites, and tumor cells. They're only about 1% the blood volume. You're supposed to have a normal average of 4,800 to 10,800. Okay? They travel around in the circulatory system. They go where they're needed. They can slip into and out of blood vessels, into tissue, do their job, and come back in without any damage to blood vessels, altering of blood vessels, or damage to themselves. Okay? So let's talk about injury. I always like knives, don't know why, but let's just say you get stabbed. When you get stabbed, some tissue is damaged. Okay? Any tissue or cells that are damaged are going to automatically release a chemical messenger. It's called positive chemotaxis. This chemical messenger calls for help. So what happens is any cells, any white blood cells that are traveling around the blood vessel, they come to an area where they can sense that there is this chemical being released. Then what it does, it becomes sticky and sticks to the side of the blood vessel and slows down. When it gets just below the area of damage, using diapedesis, it pushes through the blood vessel into the tissue. It travels through the tissue in an amoeba-like fashion to get to where the area of damage is and help the cell. Okay? When you have an injury, when you have an infection, white blood cells are called in by large numbers. They're not called in by like 5 or 6 to help you out. If you do a CBC at your doctor's office, you're going to notice that you don't just have, a couple thousand over. It should be significant numbers. The doctor then knows how bad of an infection you truly have. Okay? Two types. You've got granulocytes. Granulocytes, by definition, are going to be stained purplish by Wright stain. The examples of granulocytes, the first one is neutrophil. Most numerous, many lobules, and turn to phagocytes at any infection site. Eosinophils, okay, they have red granules. They're bilobed. They're involved with allergy response and any parasitic worm infection. Okay. Basophils are the last granulocytes. They're the rarest. They have blue granules all over them. Spectacular under a microscope. Those granules are histamine. Histamine, again, is involved with permeability, allowing things to open up. Okay, so what happens generally is if you're having an allergic response, the basophils will go to the area, release all the histamine. The histamine will cause the tissue to be leaky, so things can travel into it much more easily. In fights the eosinophils, which will finish the allergic response. Okay, let's talk about agranulocytes. Agranulocytes There's two types, that means without granules. The first one is lymphocyte, huge nucleus, almost the entire cell, found definitely in lymphatic tissue, involved in the immune response, and there's two types. B lymphocytes, which are antibodies, and T lymphocytes. They're involved with so much. Graft rejection, fighting tumors, attacking viruses. They're extremely important for survival. Okay? The last agranulosite is going to be a monocyte. It's the largest white blood cell by size. The nucleus is like U-shaped or kidney-shaped. This one's cool. It turns into a macrophage when it goes into tissues and it knows that there is a chronic infection. Okay? Kind of cool. You know the order to remember white blood cells in order of abundancies from most to least. Never let monkeys eat bananas. Neutrophils, lymphocytes, monocytes, eosinophils, and basophils. Great little saying. You won't forget it, and it helps you remember which one is the most and which one's the least. For leukopoiesis would be the production lifespan of leukocytes. Know that it starts with a stem cell. Know that it can go in either direction, and if it goes into one direction, it's for agranulocytes. If it goes in the other, it goes for granulocytes. It's pretty much named for, which one it's going to stimulate into. Just cool. I don't want you to memorize the whole thing. Just understand that it's really cool what we're needed or what your body needs. Like if you have an allergic reaction, it knows to go towards granulocytes to have basophil and eosinophil come into effect. Okay? Know the more diseases I talked about, leukemia, mononucleosis. Platelets, a cool little thing. What you do is like you've got a mega karyocyte, which is, a huge cell, maybe not this big, but you get the idea. It's a mega karyocyte, hence the name. What happens is it's like pieces just break off, and when it breaks off, it fragments out. Those fragments don't just dissolve or get engulfed by a macrophage. They're kept into your body because they're useful in making a clot. Okay? 300,000, you don't have to memorize that, no. Just know they're highly abundant and they're really important. And if they're not, you're going to have a problem clotting. You'll be a bleeder. Okay? All right. Hematopoiesis, that comes from red bone marrow again. By definition, red bone marrow is found in myeloid tissue. All right. Some cool stuff. Hemostasis. Okay, hemostasis is blood flow through endothelium blood vessel walls. Okay, so hemostasis is, okay, there's been a problem. There's been damage. How are we going to fix it? Okay, one is damage. Okay, the damage, what happens is let's say, continue with the stabbing theory. You've been stabbed in, let's say, your deltoid. So when you're stabbed in your deltoid, you're automatically going to have vascular spasms go off. What it is a smooth muscle pulsating, trying to get that constriction to those blood vessels to help stop, the bleed. When you see these bad horror shows, and on that bad horror show, you've got somebody, when you cut them, their bleeding is spurting out, and it's ton, and it looks like it's squirting all over. There's truth to that. That's just reiterating very dramatically a vascular spasm. Okay. The second thing that happens in hemostasis is going to be platelets. Platelets are actually going to be drawn to the area, and they're going to adhere to either side of the torn tissue. And when they do that, they pretty much build a dam. When they build the dam, it causes a plug, and then lastly you have coagulation. In comes the fibrin. Fibrin is a mesh protein. It literally looks like a net. So any cells, red blood cells, any platelets that are adhering to that, stuck to that dam area in step 2 is going to be held in place by fibrin. Fibrin is going to encircle it and keep it there until the area heals. Then it releases and everything's gone. Okay, so let's see. Make sure you know the phases of coagulation. Okay, make sure you understand clot retraction. You're healed now, so clot retraction comes in. That's when the fibrin breaks apart, it dissolves, it's digested by an enzyme called plamin. Okay, when it does that, all the stuff that was in it, the cells and the platelets, are released and it breaks apart, and then it freely flows like normal because it's healed. It's just like on the outside, the clot disappears, the scab falls off. You may or may not have a scar, but it's healed, it's not leaking blood any longer. Okay, make sure you know thrombosis, embolus, hemophilia. Okay, make sure you understand about transfusions. Not a big deal. They can help you out as long as it's normal. If you lose a little bit of blood, meaning 15 to 30% by volume, you're going to be dizzy and weak and look really pale. Happens all the time when you donate blood. Some are more sensitive to the loss of a pint than others. Okay, so but if you lose more than 30% of blood by volume, you're going to go into severe shock and possible death. That's where the doctors are freaking out to make it stop. You've seen those shows where it was a gunshot wound or something with tons of ricochet. The blood is pouring out of them and they're squeezing blood back into the patient trying to save their life. Because when it goes to this level, you don't have a lot of chance of survival. Okay. When you collect blood from a donor, it's mixed with an anticoagulant so it doesn't coagulate. It's stored at 39.2 degrees Fahrenheit, and it is limited to 35 days. I don't care if it's a bus full of adults. At 35 days, that's it. At day 36, it's gone. It's disposed of. You can't use it. Okay? It doesn't have the same qualities. You know that you can't just donate to anybody. You know that you just can't accept blood from anybody. You can become very sick with that. Okay? You know that on the surface on your red blood cells are markers. Okay? There's something that says self. If you are type A, you've got A markers on the surface of your red blood cells. If you're type B, you got B markers on the surface, etc. all the way through. If you're O, you have no markers on the surface. Okay? So what happens is you can't mix them up because your body would recognize them as non-self and try to splice them and kill them. Okay? Transfusion errors, you can die, but it's got to be a really amount of blood going in and it's not picked up. Okay? Okay, let's see, antigens, make sure you use that chart that I've given you. It's really great on how to read about type A, B, or O. I think it helps a lot. The Rh factor, what does it represent? It's just another marker on the cell. There's so many more, but we don't deal with all of them. Okay, so you have that Rh marker on there. You're either positive or negative. If you're positive, it's there. If it's negative, it's not there. Okay, transfusion of patient with Rh. So I'm Rh negative. If you give me blood with Rh positive, nothing happens. Okay? Whenever you do something that's opposite into the Rh factor, you're asking for problems because eventually your body will build up antibodies against it. I'm negative. If my baby was positive, nothing would happen on that first pregnancy. I'd give birth, child would be fine. If I got pregnant again with an Rh positive and I'm still Rh negative, our blood is going to intertwine. I have built up antibodies against Rh positive because when I gave blood, our blood intermingled. So now I have antibodies against it. Those antibodies would come across the placenta and the child would possibly, more than likely, be miscarried. So think about it. Usually the first interaction between opposite Rh factors is not the big deal. It's the second time that causes the permanent problem. Okay? Alright, I hope that helped a lot. Maybe just hearing my voice because it's so pleasant was great. Again, keep up the good work. Keep studying. You're doing a really great job. And I'll see you again. Bye.